This presentation is on phenobarbital by Wick and Meghan.
Systems.
Okay, for class and dosages, phenobarbital is a long-acting barbiturate. It's a Schedule 4 drug, so you need a prescription from a physician. And dosages are varied, but you'll usually take between 30 and 60 milligrams per day, depending on what pathology you're taking it for.
Indications for phenobarbital include sedation, seizures, such as generalized tonic-clonic, simple or complex partial, status epilepticus, and alcohol withdrawal.
Precautions for phenobarbital include anemia, age 65 or over, cardiac disease, depression, drug abuse, and those are correlated drug abuse and the older age patients. You want to watch out for that. Hepatic impairment, hyperthyroidism, hypoadrenalism, and renal impairment.
Contraindications for phenobarbital include hypersensitivity to barbiturates, marked hepatic impairment, dyspnea or airway obstructions, porphyria, use in patients with prior addiction, or nephritic problems.
Administration for phenobarbital includes oral, IV, and intramuscular, with oral being the most common.
Here's a list of all the adverse reactions that can occur with phenobarbital. On the next slide, we will discuss the main ones that you should be concerned about. The main adverse reactions you should be concerned about with phenobarbital is respiratory distress, agitation, nystagmus, ataxia, and skin problems. In children, you could see the reactions of having an increase in seizures or hyperactivity.
For the mechanism of action, it's going to depress sensory cortex and motor activity. It's going to alter cerebellar function, which can cause drowsiness, sedation, hypnosis, and respiratory depression. It potentiates the effects GABA has on GABA A receptors.
The pharmacokinetics for phenobarbital, the administration, like we mentioned earlier, is oral, IV, or intramuscular. Distribution is normally even through the body, but it all eventually goes to the brain. It's metabolized in the liver and excreted through the urine.
When monitoring patients taking phenobarbital, you can watch serum concentration, CNS status, liver enzymes, CBC or complete blood count, renal function, seizure activity, signs and symptoms of possible suicide, and with IV intake, you can watch respiratory rate and blood pressure closely.
Some important drugs that can interact with phenobarbital include acetaminophen or Tylenol, and the effects of that drug may be decreased if the patient is on phenobarbital. Phenobarbital may increase the effects of CNS depressants, such as antihistamines, sedatives, or alcohol, and then MAOIs inhibit the metabolism of barbiturates.
Drugs that complement phenobarbital, bumetanide, along with phenobarbital, decreases the duration and frequency of seizures, and it does this by maximizing anticonvulsant properties of GABA.
One major special consideration for patients taking phenobarbital is pregnancy. So anti-seizure medications in women who are pregnant can cause the baby to be at risk for congenital malformities such as neural tube defects, cleft palate, or microencephaly. Since the baby is put at risk, the mother may decide to stop taking the drugs, which could put her at risk for uncontrolled seizures. So what they recommend the mother to do is to take one drug at a low dose and keep watching the prenatal health of the baby, and then watch for growing into deficit functions in early childhood while the child is still growing up.
Okay, we reviewed two studies on phenobarbital use. The first is treatment of alcohol withdrawal compared to the CIWA protocol, which is the standard. And phenobarbital was proven as a good alternative for those patients who are critically ill and going through withdrawal. It was also effective in temporal lobe epilepsy attacks with bumetanide use, and it complemented the GABA effects as we stated earlier.
So two important things for physical therapy with phenobarbital is the first is that it can cause sedation. So it's important to know when the patient is taking these medications so that, as we discussed in systems class, the physical therapist can go in before the sedative effects occur. The other thing to watch out for is the agitation that it can cause. So when working with one of these patients, they could get easily agitated with you during physical therapy. So it's just important to know that and be pharmacovigilant. These are our resources, and if you have any questions on phenobarbital, feel free to ask me or Rick in class or comment below.